Thanks, Chair. Yeah, thanks very much to our speakers. I want to ask the Cancer Society specifically about the cervical screening. And I think I'm one of the last speakers now, so apologies if this has been raised already, but I'm wondering, would you have any information or figures for exactly, particularly for the Carlow Kilkenny region, how many women are waiting on a retest, not the initial test, but a retest where there was symptoms? And given now all of the delays and everything with COVID, would you know how long that backlog would be specifically for that region? And if you don't have that specific information, maybe in general you could comment on the issue of the cervical screening and the delays, please.
Thank you, Deputy. I'm afraid we don't have that data, but I'd encourage you. I think the screening service is in this afternoon, and they may have that data. And if they don't, we can certainly ask them through our own channels if you don't receive it. With regard to the resumption of screening, like I said earlier, and I'm sorry if you missed it, but we do welcome the resumption of cervical check, but we're disappointed that bowel screen and breast check have not resumed. We don't have sight of specific data with regard to backlogs that for the official figures. So the screening service may be able to talk to you this afternoon about specifically what it is. We've done our own calculations with regard to the number of cancers and precancers that have gone undetected, or we think that have gone undetected during the period that screening has been paused. And with regard to cervical cancer, we think that in the last 4 months there would have been about 1,000 precancers that wouldn't have been detected, and about 33 cervical cancers. So that's obviously of major concern to us, and just underscores the need for the screening services to resume as fully as they can as soon as it's safe to do so.
Thanks. And my second question is also linked, or is also for the Cancer Society. I know obviously this was a very serious situation and everybody has to take all of the advice and the public health measures seriously, but do you believe that there was the need to cut the services to the level that they did? Was there not some safe way of being able to carry out some of these cancer screenings, in your opinion, I suppose, given, I mean, obviously COVID is extremely serious, but there are so many illnesses, and cancer being one of them, that affects so many people, and obviously early diagnosis is key in everything. I'm just wondering if there was not a way for us to be able to carry out some of those screenings. I'd just like to know what your opinions are on that.
The advice that was taken by the screening service and by the health services generally was by NEFIT, and I think that was the evidence base on which screening was paused. So I'm afraid I can't answer as to whether that was the right decision or not, but that was NEFIT's advice.
The only reason I asked that is a lot of women in particular would have contacted myself, and I'm sure they contacted other people too, just with the frustration of seeing certain shops and retail outlets being allowed to open, and yet they know that they needed maybe a secondary test and they're being told that was too risky. You know, I suppose just the irony of that, particularly if you're worried and you're in that situation. You know, I just think myself that maybe some of the screenings and at some point could have maybe been resumed a little bit earlier than they currently have, and as you've just said, a lot of them haven't even been resumed.
Deputy, perhaps I can address that insofar as we didn't know in March what the pandemic was going to bring to us in terms of COVID-19 and in terms of the capacity in the hospitals. So we supported the decision to pause the screening services at that time. Similar decisions were taken right across the European Union. Many countries shut down their screening services. But what many have done is resume their services quicker than we have in Ireland. So I think what we need, or what we are lacking, is that ambition to get those screening services up and running and to link them into the capacity in the hospitals that is required to manage patients who, having gone through the screening programme, need further diagnostics and treatment.
Thanks, Chair. That's it.